Today we have a short lecture on the skull, trying to make a few points that weren't in your book and to introduce you to the bones you need to know for the test. First thing to discuss is the paranasal sinuses. Para means around, nasal means nose, and sinus is really a hollow portion. So these are cavities in your face that are within the bone that are hollow. There's a couple functions to these. First of all, they lighten the skull. So by having spaces in the bone that are filled with air rather than bone tissue, the skull weighs less. Secondly, this has some effect on the quality of your voice. So it allows the sound wave to sort of resonate and amplify as you speak. You know that when you have a cold, your voice sounds different, and that's because the air is not going through your paranasal sinuses. You also know when you have a sinus infection. You might find that your teeth hurt, or this area right above your teeth just sort of hurts, and that's an indication that those sinuses are full of fluid. Just to talk a little bit about the fetal skull, basically it is large in terms of the size of the head to the baby's body. In addition, the ratios of these bones are different, so that a baby's face looks quite different than an adult face. On this chart you can kind of see the proportion of the head to the total body size. So at birth your head makes up about 1/4 of your body length. And as you get to be an adult, well then that becomes a lot less than a quarter, maybe 10% of your total body length. The fetal skull also has soft spots, as we call them, and these serve a number of functions. They first of all allow the bones of the skull to move past one another a bit during the birth process. These fontanelles, or soft spots, are fibrous tissue that then connect the cranial bones to one another. In addition, they have the function of allowing the brain to grow as the child develops. And then eventually, when the skull has reached its full size, they will ossify into bone. And that process takes somewhere about 2 years before the brain, or the skull, is completely ossified. All right, moving on then. These are the 4 main bones that make up the skull. The frontal bone is the big yellow one that you would see as your forehead. The parietal bone is the green one. And I remember this because I'm Catholic, and the Pope wears a tiny little hat on his head over that part whenever he's out in public. So Pope, parietal bone. The temporal bone then is the orange one, which is in the area of your head that we refer to as your temples. And the occipital lobe is in the back and underneath your skull. You notice these sutures, which I'm not going to make you learn the names of, but the idea that they are not perfectly flat but are rough gives them better strength. So there's more resistance to the frontal bone being shifted alongside the parietal bone because we have these little indentations. So think about like your 2 fingers. If you put your 2 index fingers together, they slide by one another quite easily. If you take your knuckles and rub them, there's a lot more friction or resistance there. Kind of how these little sutures help to strengthen the skull. This is just a picture of the bottom to show you the foramen magnum. Foramen means whole, magnum means big. So this is just the big opening on the bottom of your skull that allows your spine to exit. Moving to the jaw then, we have the maxilla on the top, that's the purple part, and the mandible on the bottom. And again, we see a foramen in here, just an opening. Now we're looking at some of the bones that are a little bit more on the side. So starting from the back, the zygomatic process is an extension of the temporal bone. So process basically means that, as it does down here. It's an extension of a bone where usually some muscle will attach. The external acoustic meatus is simply the hole in your head through the bone that allows the sound to get to your eardrum. The mastoid process is here on the bottom, and that's an attachment point for a muscle that we're going to learn in the next unit. Moving over here, the zygomatic bone is kind of the cheekbone. The nasal one is the blue one here that makes up the bridge of your nose. The lacrimal gland is right on the inside. And we're learning that one because we're going to learn about 4 more words when we learn about eyes that start with the word lacrimal. Lacrimal has to do with making tears. And the sphenoid bone is this pink one. And it actually goes from one side of your head to the other. So it kind of looks like a butterfly. This might be the right side of your head, this might be the left side. And it goes across the back. Another view, so you can kind of see it going across from the left temporal to the right temporal. These are the same bones, simply looking from the front. So you should know the bones from both sides. The nasal bone making the bridge of your nose, the lacrimal where the tear ducts are going to be, the sphenoid bone going all the way across, the zygomatic or part of your cheekbone where it articulates or matches up with your maxilla, and then the mandible underneath. You can see there's lots of other things that we're simply not at this point in time going to learn the names to. This is from a superior view, so it's as if you are looking into and at the bottom of the skull, but from the inside. So we see the foramen magnum here in the middle. The other foramen that I want you to know is the jugular one. You notice there's a bunch of other ones, but you only need to know these 2. From an inferior, looking from the bottom, we'll add a couple or one additional piece to know. So again, the foramen magnum is the big hole. The jugular foramen is out here where your jugular vein exits from your skull. And then the occipital condyle. Condyle is kind of a smooth part where 2 bones meet. That is where your head sits on your spinal cord. Specifically, the occipital condyle will line up with the atlas, which is the first bone in your spine. In order to practice these, there's some really good websites online, and I want to know why the bell rings every time I'm recording this. Anyway, Web Anatomy at the U of M has good resources to use. There's some online flashcards for pronunciation in this particular unit, and there's a PowerPoint that I made to help you practice the skull bones that has a test as well as the answers following.